I want to start by asking you a very simple but uncomfortable question. When you hear the word homelessness, who do you see? Visualize, picture. For many of us, it's a distant figure. Maybe an old man with a cup, maybe someone pushing a shopping cart with beer cans in it. Maybe someone sleeping on a bench. If that's the only image we have, we're already behind, because the face of homelessness in our city, across our country, and across our continent has changed. Unfortunately, our response has not. Today, homelessness is no longer something happening over there or something happening to someone else. It's becoming younger, it's becoming older, it's becoming more diverse and spread out all across our city. So we need to rethink our approach. In the last 3 years, really tough statistic to share with you, homelessness has increased across our province by 20%. It's a big number. So that we need, therefore, to go to the source and close the tap. We need to start preventing homelessness. And here's why. What we're seeing today is unprecedented. People who never imagined they could lose their housing are suddenly becoming one rent increase, one illness, one separation, one missed paycheck away from the street. Families, seniors, students, workers, people who were stable for decades. The numbers are rising everywhere. Our shelters are full at the Old Brewery, they're full everywhere. Public spaces are becoming living spaces. You who travel the metros, you know that. And the pipeline into homelessness is growing faster than our ability to pull people out. We are trying to empty a bathtub with a teaspoon while the faucet is still running. According to the last available data, in the city of Montreal, there are a minimum of 5,000 people who will be homeless tonight. Those are the 5,000 people who have been counted, so the number is actually much higher. And while homelessness used to be limited to major urban centers, as you've probably heard, it's all around as well. Gatineau, Sherbrooke, Three Rivers, Quebec City. So why should we be concerned? Once someone falls into homelessness, everything becomes harder. Mobility decreases, health deteriorates, hospitalizations increase, aging accelerates. It's what we call in French le vieillissement prématuré. A person living on the street is actually aging faster than we are. About 10 to 20 years is their life expectancy less than someone who's not in the street. We often say that when it comes to homelessness, one gets old quickly, but dies young. Very tough thing to say. Homelessness is not just a housing loss, it's a life-altering trauma. It's something to be avoided at any cost. You never want to trade with someone who's homeless. Parks, metro stations, hospital waiting rooms, spaces meant for everyone are becoming last resort shelters. Not because people want to be there. They didn't dream of this in school. They're there because they have to be there. They have nowhere else to go. A person experiencing homelessness is very expensive to the state. Healthcare system estimates that it's about 6 times more to serve someone who's homeless than someone who's not. That works out to about $5,000 per day and about $72,000 per year for someone living in chronic homelessness. And that, if you do the math, is about $1 billion a year that the Quebec government spends to actually keep people homeless. And of course, that's just the financial cost. It's not the human cost. Many of us are 1 or 2 unfortunate breaks away from needing some help. But this is not to say that anyone in this room could become homeless. You have friends, you have family, you have savings. You have maybe a cleaning lady who brings you food. But not everybody does. And when things start to crumble, asking for help can sometimes be difficult. For decades, our approach has been reactive. We wait. At the Old Brewery, for a century, we waited until people became homeless and we said, come on in. You're welcome here. We wait until the crisis is already full-blown. Our system is built around treating homelessness and not preventing it. Now, imagine if we viewed traffic accidents the same way we view homelessness. No seatbelts, no child car seats, no airbags, no drunk driving laws, no highway fencing, no public education campaigns. Just ambulances arriving at the scene of the accident to treat the victims. It's unthinkable. Yet that's pretty much what's happening in homelessness. Everything is invested in emergency services. We gotta stop doing this. What if we flipped the script? What if we identified people at risk of homelessness before they lost their housing? What if we intervened early, quickly, effectively, efficiently? What if we treated housing stability the same way we treat road safety? We need to stop waiting and start preventing. At the Old Brewery Mission, we have proved that preventing homelessness can be done. First hopeful thing I've said. And I'm going to tell you how in just a minute. But let me first tell you what prevention actually is. Homelessness prevention means taking early, targeted action to stop people from losing their housing by addressing the risks upstream before the crisis actually happens, through supports like eviction prevention, system exit planning, income and legal assistance, and coordinated community responses. Prevention is about catching people at the moment when a relatively small intervention can change the entire trajectory of their lives. You probably know people. You probably know people who know people, kids who've been kicked out of their apartments, older people, people with mental illness, people with cognition issues, people with a little bit of an X factor, very vulnerable to evictions, and it happens a lot. I'll get back to that a little more later. It really is one of the biggest causes of homelessness. Here's how we prevent homelessness at our organizations. We've really tried to focus on partnerships. We made a decision in 2021 to launch our prevention services when we accepted that treatment alone is manifestly not working. The numbers are going up. We can't just wait anymore. The journey into the street starts obviously much earlier. You may think it starts in the shelter. It doesn't. That's really where the journey can actually start to find itself unwound and people find themselves in housing. We've built programs and partnerships that identify people at risk. We intervene early and we stabilize their housing, or we find a housing alternative before the crisis explodes. In reality, it means working hand in hand with different organizations and institutions that can identify people at risk of homelessness. So where are they? They're in hospitals, they're in prisons, they're in front of the rental boards, they're in connection with organizations working with seniors and working with young people at risk. It means our teams, the Old Brewery prevention teams, are making calls, finding housing solutions, and even supplementing rent when that's the right thing to do. And the results speak for themselves. We've helped over 600 people find a housing solution to avoid the street. That's 600 people who did not end up in the shelters, who did not lose their health, did not lose their dignity. People who stayed housed, stayed safe, and stayed connected. And the social cost of prevention? Fraction of the cost of chronic homelessness, truly a fraction. Prevention is not only compassionate, it's economically smart. And while what we're doing at the Old Brewery is really amazing, I'm really proud of the teams and what we're capable of, it's 600 people. We've got to do much more than that, clearly. We need help, we need to bring people together, and that's why we initiated, also in 2021, the Québec Homelessness Prevention Collaborative. This consortium, in French we call it le Collectif Québécois pour la prévention de l'itinérance, cqpi, check it out, cqpi.ca. This consortium brings together professionals from academia, the community sector, and public service to promote homeless prevention and develop recommendations to government for systems reform. We've heard about systems problems during this TEDx talk. This is another systems problem. According to their studies, there's 4 big measures that have to be undertaken. We need a right to housing in this province. Did you know we don't have a right to housing in Quebec? We don't have it anywhere in the country, really. We need to add it as a part of our Quebec Charter of Human Rights and Freedoms. We need to ground the right to housing in the law. Social housing, you hear a lot about social housing, but that's nonprofit housing, co-op housing, or public housing. It's a tool for economic and social resilience, essential for reducing homelessness, protecting households, and lowering public costs. These are amazing investments. Old Brewery, we have over 500 units of social housing. It's not nearly enough. We need transformational investments by our governments to help poor people stay housed and those who are in homelessness get housed. We need to prevent unjustified evictions. 23% of everybody who is homeless out there is there because of an eviction. It's the #1 reason. 1 in 4 people on the street is there as a result of an eviction. So we need to help tenants at risk of eviction. We need to ban unjustified evictions that lead to homelessness, and we need to introduce a rent bank and a lease registry right across the province. And this is my favorite one. Every day, prisons, youth protection centers, and hospitals release people directly onto the streets. These are our public institutions that are generating homelessness. We need to establish a legal duty of care that requires these public institutions to identify people at risk within their midst and properly plan their transition and support them to avoid homelessness. How about that? So we often talk about homelessness as if it were inevitable. You see that person out there, well, it had to be. It's not a natural disaster. It's not, I promise you. People we've helped house or avoid homelessness are numerous. People sometimes you never would have thought would be able to stay housed are staying housed. Most people with mental illness are housed. Most people with addiction are housed. There's no reason why everybody can't be housed. What we've got is a systems failure, and systems can be redesigned. We have a choice. We can continue pouring resources into emergency responses, and by the way, we need to continue to provide for an emergency response. When there's a fire, you have to put the fire out. But we need to start investing in prevention in a big, big way. We've proved that it works at the Old Brewery Mission. We're advocating for government to do more. But what about you? What's your role in all this? What can you do to help prevent homelessness? Here's my ask. When you hear that a new social housing project is coming to your neighborhood, any housing project for vulnerable people is coming to your neighborhood, put up your hand and say, good idea. Welcome to our neighborhood. Please show your support for the organizations that are bringing that project forward. Spread the word. Show policymakers and elected officials that these projects are not only welcomed in your neighborhood, but essential to your neighborhood.